Patrick Hutzel from intensivecarehotline.com with another quick tip for families in intensive care. Today I have an email from Sanya who says, "Hi Patrick, I have my 9-month-old baby in intensive care. She had 4 failed extubations and she had to have a tracheostomy and has been stuck on a ventilator since May. Her respiratory rate has been high since birth. When she's asleep, it's been between 50 and 60 breaths per minute, but when she's awake, it's anything between 70 to 90 breaths per minute. She currently has a PEEP of 10 and pressure control and pressure support of 6. Do you have any advice on how we are able to wean her off? She has no airway issues. CT scan was okay. The only thing that the doctors say is that her lung volume is less than a baby her age. Can you please advise?" Well, that's a great question, Sania. Number of observations there. If your baby is 9 months old and she had 4 failed extubation and she now has a tracheostomy, one thing you haven't checked is your baby, was she prematurely born? Because, we have seen many babies that are prematurely born and then they are ventilator dependent. But I'll come back to the prematurely born babies in a minute. Let's just quickly look what else is happening here. If they can't wean her off the ventilator, similar to adults, get rid of all sedation, opiates, mobilize. It's more difficult to do breathing exercises with kids because they may or may not be able to follow, those instructions. However, it's not dissimilar to kids. You reduce PEEP, you reduce pressure support, you change from a controlled mode to a CPAP or a pressure support mode, right? And get your baby to breathe more and more spontaneously, and then hopefully she can move towards having time off the ventilator. Very similar to adults. Now, if she has decreased lung volume, why is that? I don't know. Does she have a pneumothorax? Is she a prematurely born baby, i.e. surfactant of the lungs is not fully developed yet, right? Because that is what often gets premature babies off the ventilator. Eventually, the surfactant develops over time. Next, if she has decreased lung volumes, does she have excessive secretions, right? Are there some other mechanical obstructions in the lung? First one that comes to mind is, of course, secretions, right? Next one that comes to mind, God forbid, is a tumor. I would hope that is not the case, but, just to get you thinking that there could be a mechanical obstruction as well. Next, if lung volume stays decreased, often a bronchoscopy is being done to have a look what's happening there in the lungs, i.e. a camera is being put down the lungs through the tracheostomy. Has that been done? Right. So really, it's not dissimilar to weaning an adult off the ventilator and the tracheostomy, right? So question is, why does your child have a decreased lung capacity, lung volume? Is it just not developed, or is it simply, is there a mechanical obstruction, right? The other thing that you haven't shared is she in a controlled ventilation mode, i.e. is the ventilator doing most of the breathing, or is she now in a mode where she needs to trigger all the breaths like CPAP or pressure support? That would be good to know. Again, the biggest challenge for families in intensive care is that they don't know what they don't know. They don't know what to look for. They don't know what questions to ask. They don't know their rights, and they don't know how to manage doctors and nurses in intensive care. That is, exactly one of the challenges you are having here. Now, if mechanical ventilation weaning fails, Sania, the best next step is intensive care at home. Your daughter should not be in ICU for 9 months. Like, I can see from the timing of your email that she's been in ICU now for 9 months. She should go home with intensive care at home. So go and check out intensive care at home, where we are specialized to send intensive care nurses and pediatric intensive care nurses into the home, predominantly for long-term ventilation and tracheostomy weaning. So, you know, you are probably living in ICU, and that is not a good situation. So go and check out intensivecareathome.com. And because we get so many questions for families of critically ill patients in intensive care here at intensivecarehotline.com, that's why we created a membership for families of critically ill patients in intensive care. And you can get access and become a member by going to intensivecarehotline.com, by clicking on the membership link. In the membership, you have access to me and my team 24 hours a day via email, and we answer all questions intensive care related. You can also go to intensivecaresupport.org directly to get access to our membership. In the membership, you also get a library of 21 ebooks and 21 videos that are specifically written and recorded for families of critically ill patients in intensive care that help you to make informed decisions, have peace of mind, control, power, and influence. I have worked in critical care / intensive care for nearly 25 years in 3 different countries, where I also worked as a nurse manager for over 5 years. And I have been consulting and advocating for families in intensive care since 2013 here at intensivecarehotline.com. We have saved lives with our consulting and advocacy, and it's not the slightest hint of exaggeration. Have a look at our testimonials and have a look at our podcast section where we have client interviews as well. Because of that, I also offer one-on-one consulting and advocacy over the phone, Skype, Zoom, WhatsApp, whichever medium works best for you. I talk to you and your families directly, and that will make all the difference for you and your family once you understand more about intensive care, how to navigate the territory. You know, you are in a much better position to make informed decisions, have peace of mind, control, power, and influence. I also talk to doctors and nurses directly with you or on your behalf. And once again, you will see that the dynamics will change in your favor in no time. Once the intensive care team knows you have someone on your team that speaks their language and understands intensive care inside out just as they do, but come from a family and patient perspective, not from a hospital perspective. We also offer medical record reviews in real time so that you can get a second opinion in real time. So once again, that you make informed decisions, have peace of mind, control, power, and influence. We also offer medical record reviews after intensive care if you have unanswered questions, if you need closure, or if you are simply suspecting medical negligence. I also represent you in family meetings with intensive care teams, that once again, making sure your loved one gets best care and treatment, and making sure you make informed decisions, have peace of mind, control, power, and influence. And all of that you get at intensivecarehotline.com. Call us on one of the numbers on the top of our website, or simply send us an email to support@intensivecarehotline.com with your comments and questions. And if you like my videos, subscribe to my YouTube channel for regular updates for families in intensive care. Click the like button, click the notification bell, comment below what you want to see next, what questions and insights you have from this video. Share the video with your friends and families. Thank you so much for watching. This is Patrick Hutzel from intensivecarehotline.com, and I will talk to you in a few days. Take care for now.